So, I come from a large multicultural family, or 10 children in our family. And my parents, my father made it to 6th grade. My mother didn't quite graduate high school. But they always had a strong faith in me and my capacity to learn. I loved school. I was a good student. So I never thought much about how far they had progressed as students. I didn't come from a family with a lot of educational background, but they were learners, they were curious. My dad was a machinist and tool and die maker. My mom worked for an insurance company, and then later she started her own restaurant. So very entrepreneurial, very smart, bright people who didn't have the same opportunities that I had. I felt that my entire life, that part of I understood that there's a greater good, and that if I have capacity, that I need to share that capacity. And so I learned that from church, I learned that from my community. And so when I started working with vulnerable youth and populations, I realized that it wasn't a huge difference between us, that the opportunity was the difference, and that people thought I could do well in school, they believed in me, and I had those opportunities. So early on, I was committed to, how do I create opportunities for people who don't have them? I feel so blessed and so fortunate that my commitment is to provide those opportunities to others. There's so many examples of people doing good things for others. There's so many examples of people healing communities and individuals that keeps me going. And there's always going to be challenges and struggles, but I'm an optimist. I see things half full always, and so I know I do that, and I know that that's part of who I am, and that's part of my role as a leader, is to keep people optimistic about what's possible. Yeah, I wanted to, what a lot of young people, I wanted to heal the sick, cure hunger, maybe world peace would be on the agenda. So I really thought that if you got enough like-minded people together, that you can make a difference, and that's the truth. That's what we've got here at PNWU. Educated people who get together to help other educated people go out there and serve the community. My job is to enable all those aspirations. That's my role. So I live in optimism each day. It's my craft. That's who I am. What drew me here was the unique mission. There are not many organizations that I've ever been around where everybody is aligned with the mission. They have a sense of purpose because of the mission. And it's not just a few people, it's all people, all faculty, all staff, all students. So I was impressed by that. And I was impressed by the general concern for the health of others, and concern for the mission, and just deep dedication from the people that I had met. So it was so unique that I just felt called to come here and be in this role, and that's worked out well. Well, just today, today I received, a faculty member sent me a picture of students at Barge Lincoln School doing a service opportunity there, and nobody's, I didn't know about it. It wasn't in the press, it wasn't in our publications, and there they are, maybe a dozen students, student doctors who take time out of their day to go provide some optimism to elementary school children in our community. So they sent me the photo of that, and I got real excited. It made me feel very good about our work and service. So when we're done with this conversation, I'll send a note to campus about that experience and celebrating those efforts. So for me, I get to go and generate enthusiasm and optimism for others to do their work, for our students to learn and to be encouraged by what they're doing. And I'm the chief cheerleader for PNW. There's a lot of challenges in healthcare in our country and in this region, and especially in rural and medically underserved areas. So it needs just not incremental change, it needs transformational, revolutionary changes. So we have to complete our build out as a university, as a health sciences university, because the future of healthcare is team-based, interprofessional. So we need to move towards that. We also have to move towards more partnerships, because that's the future of healthcare. We're forming new partnerships. We have a major new partnership with Multi-Care Health System that gives our students more opportunities to learn, to learn how to heal others and to work with different communities. So that's going to continue. You know, growing ourselves, extending our mission, serving all of the communities in the 5-state region. So, you know, the other thing, you know, with it too is that, you know, there is, we're part of healthcare changing. We're part of that shift. So what does that look like? And how can we help heal communities, and how can we help sustain communities? If you have a healthcare provider in a rural community, that community goes forward. If you don't, industries aren't going to come, people are going to stop living there, and it's going to go away. So it's not just, you know, the healthcare, it's part of the economic development of these communities. So that's important, and we need to be intentionally part of that going forward. I just think there are a lot of people who know a lot of things that I don't know, and so I'm just eager to continue learning, and I want our students and everybody at PNW to continue learning. It's the one thing you can't stop. You know, there are days when you have struggles, and you know, some days are better than others. You don't get as much accomplished, but you can always learn. And I think that's the wonderful thing about being in higher education. There's always opportunities to learn. It helps me appreciate where I'm at, it helps me appreciate the wonder of the world and the universe, and then all of a sudden my small work problems dissipate rather quickly.